afternoon.
Hey, how are you?
I'm good, thank you. How are you doing?
I'm doing okay.
Can you please tell me your name and date of birth before we start?
It's Sam Brown. Date of birth is January 31st, 1985.
Okay, I'm just going to go ahead and... Okay, do you have any allergies?
None that I know of.
Okay, so what brings you here this afternoon?
I'm thirsty. I'm like extremely thirsty. I'm urinating a lot. Feeling lightheaded, things of that nature.
Okay, when did you start noticing these changes?
About maybe the past few weeks.
Okay, have you noticed any weight loss or do you feel
I lost about
dehydrated?
10 pounds and I haven't even been trying to lose weight. If anything, I'm trying to gain a little bit more.
Oh, okay. How would you describe the color of your urine? Looks like water. Okay. Have you had any head injuries?
I had a few years ago, I fell off a bike and I hit my head, my frontal concrete down, went.
Oh, okay. I'm going to go ahead and start taking your vital signs, and then I'll also grab some blood to send to our lab, and then from there I'll call the doctor and they'll come in and talk to you.
Okay, but I need to use the bathroom. Can I go real quick
Yes,
before you do
I
all that?
will. Okay, hold on. Let me grab the cup because
Okay.
I would like you to do a sample urine.
Okay.
So this is whereby when you pee, you're going to have to wipe first. The first urine output, you wipe it, and then you go ahead and pee so that we can catch a clean urine supply.
So do I wipe down or up?
You wipe down, man.
Okay.
You don't wipe up because you don't want to have an infection.
Okay,
So you
okay.
wipe from up to down, and then you grab the first sample urine, and then you can bring it to me.
Okay.
And then we can go ahead, take the vital signs, and then call the doctor.
All right, I need that cup. I gotta
Okay,
go.
I got you.
All right.
Cut.
I tried to make it
That
so
was good.
funny.
That was
okay.
perfect. I love
Okay, so then I guess I don't went. I urine.
Oh, you back from the bathroom?
Yeah.
Okay, so now I'm getting ready to take your vital signs. I'm gonna take your blood pressure, and also I'm going to listen to your heart and your lungs, okay? And I'll check for edema to see if everything is going okay.
Okay. What is edema?
This is when you have swelling in your legs.
Okay.
Just to check if you have any excessive fluids.
Okay.
Alright, so you can go ahead. I will put this blood pressure cuff on you. Just relax for me.
Okay.
And then whilst I do that, I'm also going to listen to your lungs, okay?
Yes, I take lisinopril, metformin, and my favorite is Zoloft. Alright, so I'm gonna go document this.
Hello, Dr. Carissa. So I'm here to give you our ESPA for the patient that we have. So we have a 39-year-old female, and then she's complaining about excessive thirst, and also she has just lost 10 pounds in the last week. Okay. So our patient is also experiencing lightheadedness, and then she has a history of head trauma.
Hi, I'm Dr. Howard. How are you doing?
I'm doing well, and you?
Good. Thank you for coming in and letting us take care of you.
Okay.
I have taken a chance to look over your urine sample. I've taken a chance to look over your labs. And we've diagnosed as a team, we have diagnosed you with diabetes insipidus.
Diabetes.
It
The
is-
sugars?
It's, the sugars is not the issue. The issue is your kidneys are letting out a lot of urine, and so there's a hormone called vasopressin that your pituitary gland releases, and it helps to control and regulate your ability to urine and stuff. So what we're going to do is we're going to give you a medication called desmopressin, and that's going to help you not pee as much. It's going to help balance out your electrolytes. so that you can have more of a normal life and not have to go to the bathroom as much. Does that sound good to you?
That sounds great, because I'm tired of peeing how much I've been peeing lately.
That's right. So we're going to take good care of you, give you that medication to help with diabetes insipidus, which is different than diabetes mellitus. So we want to make sure you understand the difference.
So you saying I don't have diabetes, I don't have to give myself the shot or nothing like that?
You don't have the sugar diabetes.
Okay.
So that's what's common. You have the uncommon diabetes insipidus.
Okay, let me
So it can
ask
be
you
just fixed with, or not fixed and solved, but it can be helpful to take the desmopressin so that you can have regular urine output.
So is it curable? Because you said it could be helped, but is it?
So we're not going to cure it, but we're going to help you to not lose so much potassium in your urine. Because right now you have too much sodium in your bloodstream, which is making you thirsty, and then you have too little of potassium, which is making you, which is what's coming out in your pee. So, and it's really important that we regulate that potassium too. So, because too low of potassium can be very dangerous. So we want to make sure you take this medication. And our pharmacist is going to come in and tell you everything about how to take the medication.
Okay.
All right. Well, it's a pleasure working with you.
Thank you.
You'll need to come back and we'll check your blood and your urine. So make sure that you check back in with us, okay?
Okay.
All right.
Thank you,
Thank
doctor.
you. You're welcome. Okay.
Good morning, Clarissa. How are you?
Good morning, Dr.
You
Lydia.
look beautiful
Thank
today.
you. You too.
Thank
So
you.
our patient has diabetes insipidus. The medication that we need to prescribe to them is the desmopressin.
Okay.
So I'm going to have you go in and talk to her and give her a report of how to take the medication and what all the medication side effects are and stuff like that, okay?
Thank you.
All right.
See you.
Bye-bye.
Funny, but
Good morning.
hey, how are you?
Good. How are you? My
I'm
name
doing
is-
well.
Yeah, my name is Dr. Lydia. I'm the pharmacist.
Okay.
So I'm here because they told me that you have diabetes insipidus,
Okay.
and we're gonna give you a medication that's called desmopressin. So desmopressin is a medication that's gonna replace the vasopressin, the hormone that your doctor told you
Okay.
that your body doesn't produce.
Okay.
So it's gonna replace it, and it's gonna hold water inside your body, so it's gonna stop the thirst and to going many
Oh,
times.
wow. That'll be very helpful. So I'm not going to be peeing a lot and I'm not going to be thirsty.
Yes,
Okay.
that's the
Okay. Are there any side effects from this medicine?
yes. So the side effect for this medicine, because it's tell your body to hold into water. So if there is too much water, you're gonna have low level of sodium. So sodium or salt in your body, and when you have that low level of sodium, you can have symptoms like headache, nausea, confusion. But this is the most symptoms or adverse effect for this medication. But that's why you're gonna keep an eye on you, on your sodium level, to be sure that everything is perfect. Okay, so do you want me to explain how many times you have to take the medication?
I would like that.
Yeah, so you can take it once or 2 times a day.
Okay.
And if you don't want pills, you can have a nasal spray too.
I prefer that one, actually.
Okay, good. Yeah.
Okay. And so those side effects, I know it's probably not 100% guaranteed, but I might experience that.
Yes, sometimes, but this is the main adverse effect that we have to keep an eye on. It is the low sodium level, but the other symptoms is just mild. But this one, that's why we're gonna keep you here and check on your level of sodium and your blood pressure too, because
As
it can
long as it
affect.
helped me with the urine, not having the urine so much, and
Oh, stop
yeah,
it.
and me being so thirsty, then I'm willing to try it.
okay, good. Do you have any other question?
No, that's it. I gotta go use the bathroom.
Okay, good. So be safe and see you.
All right, thank
If you have any question, just call me.
I will. Thank you.
Sam,
Hey, how
how
are
did
you?
your talk with the doctor and the pharmacist go? Did you understand everything?
Yeah, I think I do. Yeah.
Okay.
Yeah.
All right. So I got your prescription right here.
Okay.
So all I need you to do after this prescription is I'm going to ask the front desk to call you to follow up with your appointment. Please make sure you come back for your appointment, okay?
Okay.
This will help us monitor your progress and take more like blood urine or sample urine if it's needed.
Okay.
Okay, and also the medication they prescribe for you is going to help you balance your electrolytes in the body. So just make sure you stay hydrated and then eat also, you know, balanced food, your nutrition, what you eat, since you have diabetes. Okay.
Okay.
All right. Do you have any questions for me?
No.
All right. Okay. I hope to see you soon during
Thank
your
you
next
so
visit.
much. Thank
It
you
was
for
a pleasure
caring for
taking
me.
care of you.
Thank you.
All right.
Thank you.